Hello everyone, welcome to Cuboid Forms Study Circle. Today we will discuss about pharmacopoeia. Let's start the discussion about pharmacopoeia. See, what is the meaning of pharmacopoeia? What helps main role functioning in pharmacopoeia, and what helps and what procedure whoever the follows in pharmacopoeia is a detailed information in this class section. Okay, let's start the pharmacopoeia. Pharmacopoeia is derived from ancient Greek word. Where from Greek words? What's the meaning of pharmacopoeia? Pharmacopoeia literally means drug making. You suppose you already get ready to pharmaceutics and preparation to the syrups. Any example are tablets or syrups and suspensions and emulsions, lotions, ointments, or capsules, semi-solid doses from all are etc. Get ready to how to procedure. Get the procedure. What's the meaning of procedure? It's a follows to helpful in pharmacopoeia. Not only drug preparations or not only any pharmacy field in pharmaceutical analysis and pharmaceutics and biotechnology and or more than pharmaceutical analysis 1 2 and instrument handles all our pharmacy related to in depends on only pharmacopoeia. Okay, see what's the meaning of pharmacopoeia? Pharmacopoeia is means of drug making, how to get prepared to the drug, how to procedure to making in drug. This is called pharmacopoeia. All right. Okay. Let's next one, types of pharmacopoeia. Okay. So not only India follows in pharmacopoeia. Before independence, followed in British pharmacopoeia. Okay. Followed in British pharmacopoeia. But 1833 East India Company's dispensary committee was recommended to publish in pharmacopoeia. Before independence, Indian pharmacopoeia is dispensary committee recommended to the publish in pharmacopoeia. First of all, 1833 is how to come the independence in 1947 to independence in India. But before pharmacopoeia is maintenance in British pharmacopoeia, not only Indian pharmacopoeia. Okay. See, next 1844 Bengal pharmacopoeia was published in listed most commonly used of indigenous and drugs, followed by Indian pharmacopoeia in 1868, which covered both the drug British pharmacopoeia, indigenous drugs used in India, and 1833 is East India Company's dispensary in drugs, but 1844 Bengal Pharmacopoeia is published in indigenous drugs, followed by Indian Pharmacopoeia in 1868. Which year followed in Indian Pharmacopoeia? 1868. Covered both drugs in British Pharmacopoeia, indigenous drugs used in India. Okay, and 1868 covered both the drugs. 1868 the covering both drugs in British Pharmacopoeia and 1867 endogenous drugs used in India. Which pharmacopoeia used in Indian drugs? 1868 covered both the drugs of British Pharmacopoeia. Okay, this is all used in before independence. All right. Okay. In 1885, British Pharmacopoeia was made official in India. Okay, 1885, British Pharmacopoeia was made official in India. Then, in 1927, drug committee was appointed by the government of India, recommended the publication of National Pharmacopoeia. Okay, National Pharmacopoeia. That's it. And after independence means 1947 to coming to the independence in India, we own pathway in India Pharmacopoeia. Indian Pharmacopoeia is Government of India published in the Indian Pharmacopoeia list in 1946. Who's the Sir R.N. Chopra? R.N. Chopra and 9 others in committee prepared this list. Who is the prepared in committee? R.N. Chopra and other 9 members committee prepared the supplement to the British Pharmacopoeia. Okay. After publication of the Indian Pharmacopoeia list, the Government of India constituted a 11-member India Pharmacopoeia committee. How many members in there? Indian constituted in publication of India Pharmacopoeia? 11. 11 members in India Pharmacopoeia committee. How many Indian Pharmacopoeia committee? 11. 11 members. Okay. In 1948, 1948, after independence, the Pharmacopoeia of India, after independence, the Indian Pharmacopoeia Committee, this is called IPC. What is the full form of IPC? Indian Pharmacopoeia Commission was constituted in 1948. Which year constituted? 1948, after independence, for publication of Indian Pharmacopoeia as its main function. Okay, and 1948 will be IPC constituted in so many publication, various editions of Indian Pharmacopoeia is presented. Okay, this is the Indian Pharmacopoeia. Okay, I will discuss about in India Pharmacopoeia. It's a mainly, but different countries depends on pharmacopoeias. Like example, United States of Pharmacopoeia, America, British Pharmacopoeia, and European Pharmacopoeia, Japanese Pharmacopoeia. Different countries and different pharmacopoeias follows in pharmacy field. Okay, I'll depth in Indian Pharmacopoeia. Let's start the Indian Pharmacopoeia. Remaining other countries are it's a main important, but India Pharmacopoeia is the first. Okay, after remaining you also read the pharmacopoeias. Okay, let's start the Indian Pharmacopoeia, right? Okay, Indian Pharmacopoeia and IPC, Indian Pharmacopoeia Commission. Okay, Indian Pharmacopoeia official document mean the overall quality control and assurance of pharmaceutical products efficacy and affordability. What's the main functions in India Pharmacopoeia Commission? It's a main role of in functioning. Drugs will be prepared in industrial pharmaceutical industry. Drug preparation to the procedure like SOP, standard operating procedure, and what terms of conditions are followed or not followed, and that is strictly instruction followed in efficacy and quality and pharmaceutical products like example tablets, semi-solid dosage forms like example semi-solid dosage forms and capsules and lotions and liquids and suspensions, emulsions, lotions, ointments, or etc. There are prepared in industrial pharmacy. Okay, industrial pharmacy it's a main followed in SOP. Depends on SOP, quality assurance. Quality assurance means in the documentation process and quality control in proper purity in checking in quality control in pharma industries. Okay, Indian Pharmacopoeia is industry any drug preparation followed in India Pharmacopoeia Commission. There are severally many editions are there in India Pharmacopoeia. Okay, right. Indian Pharmacopoeia legal status under second schedule of drugs and cosmetics. Okay, Act in 1940 and rules in 1945 thereunder. Okay, Indian Pharmacopoeia Commission legal status. It's a not a illegal procedure. It's a legal process. Legally status under second schedule of Drugs and Cosmetics Act. Depends on Drugs and Cosmetics Act. First preparation to the Drugs and Cosmetics and Act 1940 and rules in 1945 thereunder. Okay. The IPC, what's the full form of IPC? Indian Pharmacopoeia Commission. It's located in Rajnagar, Ghaziabad in Uttar Pradesh. Which state? Which state? Uttar Pradesh. Uttar Pradesh, UP. IPC located in Uttar Pradesh and Ghaziabad. The Indian Pharmacopoeia Commission is a body functioning under the Ministry of Health and Family Welfare Government of India. Which body functioning in Indian Pharmacopoeia Commission? MOHFW. Okay, Ministry of Health and Family Welfare, Government of India. Right. The current chairperson of the Indian Pharmacopoeia Commission. Who is the IPC Commission? A present current chairperson MS Punya Shalia Srivastava. Right. And second co-chairperson. Who is the co-chairperson of Indian Pharmacopoeia Commission? Professor VM Kartoch from Jawaharlal Institute is the postgraduated in medical education and research. He is also medical and research. Okay. Current chairperson is IPC MS Punya Shalila Srivastav. Is also secretary in Health and Family Welfare. Okay, right. Next slide to editions. How many editions in India Pharmacopoeia? There are totally 8 editions. How many editions? 8 editions. Okay. The first edition be the Futures of Edition, contains both Western and traditional system drugs used of India. Okay, first editions of drug 1955 to year of publication, and year of addendum released in 1960. Okay, year of publication 1955, year of addendum released in 1960. Features of edition, main features of edition in which this is years contains both Western and traditional system drugs and commonly used in India. Alright. Okay. Indian Pharmacopoeia Committee under the chairmanship Dr. B.N. Ghosh released in the first edition in Indian Pharmacopoeia. How is the released in first edition of Indian Pharmacopoeia? Dr. B.N. Ghosh. Okay, supplement to the Pharmacopoeia of India 1955 was published in 1960. Okay, remember this one first edition, and many, I think many questions are any competitive exams are GPAT or NIPER or any railways or SSC pharmacist, in particular this question and mandatory. The first edition of Indian Pharmacopoeia 1955, and what is the first edition of published in India Pharmacopoeia, first edition 1960. Okay, next the first edition of the Indian Pharmacopoeia published in 1955 contained 86 monographs. How many monographs? 986 monographs. Okay, 986 marks. 1955 contained in 986 monographs. First edition. Right? This is called first edition of the explain. Second edition. Second edition 1966. 19 second edition. Year of publication 1966 and year of edidium released in 1975. Okay, second edition. The features of edition contains both Western and traditional system drugs commonly used in India. Both Western and traditional system drugs commonly used in India. Alright. The second edition of the Indian Pharmacopoeia came out in 1966. The chairman of the Indian Pharmacopoeia Committee was Dr. B. Mukherjee, who is the released in second edition in Dr. B. Mukherjee. Okay, the supplement 1957 represented the only addendum to IP Indian Pharmacopoeia in 1966. Okay, the second edition is a totally 986 monographs. How many monographs and covers in second edition in Indian Pharmacopoeia? 986 monographs. Okay, supplement to this edition was published in 1960. Second edition is supplement to the editions published by 1960. Okay, next third edition. Third edition published in 1995 and there are two volumes in third edition. Volume 1 1989, Volume 2 1991. Okay, third edition. How many volumes are in third edition? Two volumes. Volume 1 published by the 1989, Volume 2 published in 1991. Okay, features of edition. In this pharmacopoeia, inclusions of traditional system of drugs was limited. However, most of the new drugs are manufactured and are marketed were included, while only those herbal drugs which define quality control standards and had got place in it. What's the main function of third edition? It's a pharmacopoeia inclusions. For suppose industrial pharmacy get ready to prepare in medicines and tablets and capsules, proper manufacturing or marketing with quality control. It's a main impurity quality in defined standards had got place in it. Helpful of third edition. Okay, main industry pharmacy in manufacturing of new drugs. Right. Next, fourth edition. Fourth edition is year of publication 1996 and there are three volumes are there. 2000 first edition, 2002 second, 2005 third. Right, which included a large number of antiretroviral drugs and RAM plants commonly used in making medicinal products not covered by any other pharmacopoeias and attracted much global attention. The Indian Pharmacopoeia Committee IPC decided to delete the obsolete or less used product monographs and added monographs based on the therapeutic merit, medicinal need and extent of use of such articles in the country. Right? Features of the edition: large number of antiviral drugs and raw materials making medicines and products. Okay. IP Indian Pharmacopoeia Committee decided to delete the absolute or based product monographs in therapeutic merit, medicinal need and extent of use. When mainly that time fourth edition is mainly that time more than disease, suffering from more than disease in person human beings. What more than uses of drugs is mainly uses an extent of products. Okay, who is the chairman of the Indian Pharmacopoeia Committee in fourth edition? Dr. Nityanand. Okay, Nityanand. See the next one, fifth edition. Fifth edition is year of publication in 2007. Year of addendum released in 2008. It focuses on those drugs or formulation that cover the national healthcare programs and the national essential medicines. It contained monographs or antiretroviral, anti-cancer drugs, anti-tubercular drugs, and herbal drugs. It further emphasized on biological monographs such as vaccines, immunosera for human use, blood products in biotechnological and veterinary, biological and non-biological preparations. See, main fifth editions some of drugs and released in editions antiviral drugs, anti-cancer oncology, and anti-tubercular drugs and TB and further drugs, biological drugs and schedule C biological products like example vaccines, immunosera, blood products, biotechnology, veterinary, biological and preparation. Indian Pharmacopoeia is 2007 was published in how many volumes, sir? 3 volumes. 3 volumes. Okay. The chairman for the fifth edition, who is the fifth edition of the Indian Pharmacopoeia, who is the chairman? B. Suresh as the chairman of the scientific body in IPC. Okay. Who is the chairperson of fifth edition? B. Suresh. Okay. B. Suresh. Next, sixth edition. Sixth edition of Indian Pharmacopoeia. Year of publishing 2010. Year of addendum released in 2012. Okay. Sixth edition published by the Indian Pharmacopoeia Commission, Ghaziabad. It's located in Uttar Pradesh. Okay. Sixth edition totally 3 volumes. 3 volumes in this edition. And each volume has got different features. Okay, each volume different features. Pharmacopoeia Commission acknowledgements and introduction, general chapters and reference data. Okay, volume 2, general notice and dosage forms in drug substances, dosage forms and pharmaceutical aids, A to M schedules. Okay, volume 3, drug substances, dosage forms, pharmaceutical aids, antidote schedules, vaccines, biological products mean schedule C, and immunization for human use, herbs and herbal products, the pharmacognosy relative in drugs in Ayurvedic, Vinanya, Siddha, Ayurveda, Ayush, blood and related products and biotechnology products and veterinary products. Okay, and who is the sixth edition is the IPC Indian Pharmacopoeia. Chairperson is Mr. P.K. Pradhan. P.K. Pradhan is released in sixth edition. Sixth edition. Okay. Next, seventh edition. Seventh edition published in 2014 and year of addendum released in 2015. Okay, it's presented in 4 volumes. How many volumes are? 4 volumes, including products and biotechnology, endogenous herbs, and herbal products, veterinary vaccines and additional antiretroviral drugs and formulations inclusive of commonly used in a fixed dose and combinations. Standards for the new drugs and drugs used under national health programs are in use now. ADAs are deleted from this edition. Some of drugs are editions are released in this edition, which is not used nowadays are deleted from this edition. The Indian Pharmacopoeia 2014 incorporates in 2000 2,548 monographs of drugs, out of which 577 are new monographs and added. How many new monographs added in 7th edition? 577. And okay, consisting of a active pharmaceutical ingredients and excipients, dosage forms and antibiotics, monographs and insulin products and herbal products and etc. Okay, added in this ones. 19 new radiopharmaceutical monographs and one general chapter is the first time being included in this edition. Okay, 19 new radiopharmaceutical monographs added in 7th edition. Okay, last one, 8th edition of Indian Pharmacopoeia. 8th edition, year of publication in 2018 and year of addendum released in 2019. Okay, generally chemical tests and TLC for identification of any article have been almost eliminated, and more specific infrared and UV light, UV spectrophotometer and high performance liquid chromatography tests have been given emphasis. Okay, this use chromatographic methods has been greatly extended to copy with the need for more specificity in assays, and particularly is assessing the nature and extent of impurities in ingredients and products. Okay, most of the exciting assays and related substances test methods and upgraded by liquid chromatography technique in view harmonize with other international pharmacopoeia. Okay, other international pharmacopoeia and pyrogen test and have been replaced by bacterial endotoxin test EET in parenteral preparation and others. Okay, that's the main important. Who is the 8th edition? 8th edition in the Pharmacopoeia Commission. The forms. Who is the chairperson? C.K. Mishra, Secretary Health and Family Welfare, Government of India. Okay, right. 2018 has been released in 29th September 2017 by S.H. C.K. Mishra, who is the Secretary in the 8th edition released in C.K. Mishra. Okay, is Health and Family Welfare, Government of India, in the presence of the senior officers in Ministry of Health, Family Welfare and Indian Pharmacopoeia Commission members in 8th edition released in 2018. Okay, editorium in 2019 year. Clear? So you can revision what is the pharmacopoeia, what use of pharmacopoeia, and the definition of pharmacopoeia, types of pharmacopoeias, and Indian Pharmacopoeia located in Ghaziabad, Uttar Pradesh in India. Which ministry is MOHFW. Okay, who is the chairperson, current chairperson of IPC? MS Ponyas Salalya Srinivastava. Co-chairperson is Professor VM Kautach. Okay, first edition in Ayurvedic and Unani Siddha and first beginning stages in used in Ayurvedic, first edition in 1955 to 1960, second edition 1966 and editum 1975. Okay. Chairman of the second edition, Dr. B. Mukherjee. How many monographs? 1986. Fourth edition in three editions, three volumes are there. 2001, 2002, 2005. Chairperson of Dr. Nityanand. Fifth edition is published in three volumes. Chairperson of B. Suresh. Sixth edition is IPC Ghaziabad located in Uttar Pradesh. Okay, with the chairperson Mr. P.K. Pradhan. Sixth edition P.K. Pradhan. Seventh edition is Ghulam Nabi Azad. Seventh edition of chairperson. Okay. Eighth edition is SHCK Mishra, Secretary Health and Family Welfare Government of India, and 8th edition released in 2018, edition in 2019. Some of the pharmaceutical in analysis and instruments and biotechnological products, etc. is called is Indian Pharmacopoeia. Okay. Thank you everyone. Please share, subscribe, like. Thank you everyone.